Welcome to a quick update from CCK Live. My name is Emma Peterson, and I'm joined by my colleague Maura Black. And we're going to be talking to you today about the status of the PACT Act. As you know, we've been talking about the PACT Act for a month and all the good things it's going to do for the veterans of our country, particularly post 9/11 veterans and Vietnam-era veterans. Unfortunately, the bill, which everyone assumed would pass, stalled out in the Senate yesterday. So we wanted to take this time to do a quick update to let you know about the PACT Act if you haven't heard about it yet, and talk about what happened yesterday in the Senate. So the PACT Act is going to expand care to 3.5 million veterans in our country who were exposed to burn pits post 9/11 in places like Iraq and Afghanistan. It's going to create a framework to establish future presumptions for those exposed to those toxins. It's going to expand health care, and it's also going to add 23 burn pit and toxic exposure-related conditions to VA's list of service presumptions, including hypertension. It's going to expand presumptions related to Agent Orange and herbicide exposure. It's going to strengthen federal research on toxic exposure and improve VA's resources and training for toxic exposed veterans. It's also going to invest money in VA's claims processing, in VA's workforce, and VA healthcare facilities. So it's a really all-encompassing, very important bill that pretty much everyone wants to see passed. So Maura, can you tell us what happened? Why didn't this pass yesterday?
This is a pretty unfortunate and surprising update, frankly, that we're bringing you, because what happened yesterday was not expected. Previously, the bill had been originally passed by the Senate 84-14 in the middle of June. The bill particularly received overwhelming Republican support. The legislation was ready to be passed to the House, but the bill was delayed as one section of it was debated by the Veterans Affairs Committee. So after undergoing some edits, on July 13th, the House overwhelmingly approved 342 to 88, if you want the numbers for the votes. The House overwhelmingly approved the bill and sent the package back to the Senate with only a minor change from the state of the bill that had been before the Senate when they voted to approve it back in June. Unfortunately, yesterday, only a few weeks after receiving overwhelming support in both the Senate and the House, the bill was shut down in the Senate in a 55-42 vote, which failed to meet the 60 vote threshold that the bill required for passage. This is, as I said before, this was a surprise. This is a radically different outcome than what we were expecting based on the votes that had been taken prior.
Absolutely, especially that change from 84 in favor to only 55 in favor. The list of senators who voted against this is readily available online. So if it's a senator in your home state and affects you, I recommend you give them a call. We are frustrated to say the least, and I'm sure all of you out there watching this who are affected by this bill and are entitled to receive a number of benefits, health care, service-connected disability presumptions under this bill are frustrated too. So we will be watching this closely. And if anything changes, we'll be sure to update you. In the meantime, if you want to explore more information about the bill, please be sure to check out our blog and make sure to subscribe to our channel so you get all the latest updates on what's going on with the PACT Act. Thanks for joining us.